You've spent years learning how human systems fail. You know what a deteriorating patient looks like before the monitors catch it. You understand the cascade of decisions, clinical, logistical, human, that determines whether someone walks out of hospital or doesn't. That knowledge is hard-won. It took years of being in the room when it mattered most. And here's what nobody in tech will tell you. That knowledge is exactly what the AI era of healthcare is missing. Today I want to talk about the threshold we're all standing at right now, and why the clinicians who build expertise today will be shaping care for the next 2 decades. Artificial intelligence is already reading diagnostic images across the US, UK, and Ireland. Ambient AI tools are drafting clinical notes in real time. Robotic pharmacy dispensers are reducing medication errors. Clinical decision support algorithms are being embedded into every major electronic health record system. This is not a vision of the future. It is what's happening now, at scale, in hospitals, The question isn't whether AI will transform healthcare. That ship has sailed. The question is whether clinicians will be in the room when it happens, shaping it, challenging it, guiding it toward better outcomes, or watching from the outside as others make decisions that affect the people you trained your whole career to protect. It's a choice we have to make. And here's the honest reality. Right now, the room is largely missing clinicians. The engineers are there, the data scientists are there, the product managers are there. But the clinical voice is absent in too many of those conversations. We need to change that. We need to be the architects of this transformation. Years ago, before my first professional role in digital health, I started teaching myself database technology. Not a course, not a mentor. The help files. The help files of Microsoft Access. I made every mistake imaginable. I built things that worked badly, then a little better, then well enough to do some useful things. When I eventually moved into digital health professionally, the technology had moved so far beyond what I taught myself. My Access databases were a toy by comparison. The database systems in real organizations were orders of magnitude more complex. But my understanding of how data worked, that was invaluable in a way I hadn't anticipated. I could bridge the gap. I knew what the clinicians needed, and I had enough grasp of the system to know what was achievable. That fluency was my superpower. Now we're at a bigger threshold. The tools are more powerful. The stakes are higher, and the window to build this kind of fluency is narrowing fast. Healthcare AI has a problem. It isn't technical. The algorithms make clinical errors that no nurse or doctor would make. They miss context. They fail in edge cases. A 2025 WHO report was unambiguous. The single most important factor determining whether AI tools improve or harm patient safety is the quality of clinical oversight. That oversight requires clinicians who are willing to engage, not to become data scientists, but to be the conscience in the room, to be the human heart of the machine. So how do you actually build this expertise? Here are 3 foundations. Foundation 1, AI literacy. Start this week. You do not need to become a data scientist. You need enough fluency to be effective in cross-functional teams. Understanding machine learning at a conceptual level will change every conversation you have. Start today. Foundation 2, clinical workflow, fluency. Map one clinical process you know well in data terms. What data does it generate? What decisions could be supported or automated? Foundation 3, deliberate exposure. Volunteer for committees in your current role. Every conversation is an opportunity to develop and demonstrate your emerging expertise. Get in the room even before you feel ready. The gap between knowing you should move and actually moving is where most clinicians stall. Don't let that be you. Here are 5 things you can do this week to start building expertise at the intersection of clinical knowledge and digital health. 5 actionable commitments. Step 1, start an AI fundamentals course. Pick one and begin it this week. Step 2, map one clinical workflow in data terms. Write it down. Make it concrete. Step 3, join a clinical informatics community, AMEA, the Faculty of Clinical Informatics, or eHealth Ireland. Find the community relevant to your geography and show up. Step 4, volunteer for a digital project in your current role. Step 5, find a coach or mentor who has already navigated this transition. Shorten your learning curve. The clinicians who build expertise now will be the ones leading those implementations for the next 2 decades, shaping how AI touches patient care, setting the governance. Expertise and opportunity is the 3rd pillar of the impact framework. It's about positioning yourself as someone whose insight shapes the technology, rather than being shaped by it. You went into practice because you wanted to make a difference. The AI era is the next chapter of that work, but it needs you in the room, as architects, not as passengers. Are you already making moves or watching from a distance? Drop a comment. I read everyone, and I want to hear your story. Subscribe so you don't miss the next pillar. If you're ready to stop figuring this out alone, let's talk about what your next chapter looks like. There's a link for a free consultation below. I'll see you in the next one.